Welcome to CPT Coding Guidelines Review for Vascular Embolization and Occlusion. Achieving accurate and complete coding is the purpose of coding guidelines. However, you can't take advantage of the benefit of having guidelines if you don't know what direction they provide. Even if you don't know the specifics of a guideline, just being aware that guidance is available for a particular situation is valuable. This series is designed to help you become better acquainted with often unfamiliar CPT guidelines for coding of significant procedures, with the intent of making you aware that the guidance exists to ultimately improve coding proficiency and boost confidence in knowing something about the objective of a procedure and/or how the procedure is performed always promotes understanding of the direction given in the guidelines. This installment of CPT Coding Guidelines Review covers the guidelines for coding vascular embolization and occlusion. So, before we dive into the guidelines themselves, let's take a quick look at what vascular embolization and occlusion is. Vascular embolization occludes or closes off a blood vessel to prevent blood flow. Elimination of flow may be used to address vascular abnormalities such as aneurysms or arteriovenous malformations, to prevent excessive bleeding, or to keep blood from feeding a tumor or other abnormal tissue. Embolization procedures use catheters to deliver embolic agents that close or seal off blood vessels or physically block blood flow. Embolic agents include balloons, gelatin foam, glue, sclerosing agents, metal coils, and particulates. If you're interested in learning more about vascular embolization and occlusion, please visit the website. Codes 37241 to 37244 report vascular embolization and occlusion procedures, excluding those performed on the central nervous system and the head and neck, which are reported with 61624, 61626, and 61710, and ablation and sclerotherapy for venous insufficiency or telangiectasia of the extremities or skin, which are reported with 36468, 36470, and 36471. Embolization and vascular embolization and occlusion is reported with codes from the range of 37241 to 37244. These procedures include all associated radiological supervision and interpretation, intra-procedural guidance and road mapping, and imaging necessary to document completion of the procedure. Selective catheter placement and appropriate diagnostic angiography are separately reportable. An appropriate modifier, such as modifier 59, distinct procedural service, should be appended to the codes for separately reportable services. Please see the content preceding. Code 37241 reports venous embolization for other than hemorrhage or hemodialysis access. Examples include embolization of congenital and acquired venous malformations, venous and capillary hemangiomas, varicoceles, and visceral varices. For embolization of side branches of a hemodialysis outflow vein, see Code 36909. Code 37242 reports arterial embolization for other than hemorrhage or treatment of a tumor. Examples include embolization of congenital and acquired arteriovenous malformations or fistulas, and aneurysms or pseudoaneurysms, except injection to treat extremity pseudoaneurysm, which is reported with 36002. Embolization and occlusion of an artery that is performed Code 37243 reports embolization for tissue ablation and organ infarction or ischemia. Examples include embolization of benign or malignant tumors of the liver, kidneys, and uterus, including uterine fibroids or other organs. Chemotherapy or radioisotope injections given as part of an embolization procedure are separately reportable with their respective CPT codes. Code 37244 reports embolization for hemorrhage or vascular or lymphatic extravasation, which is the leakage of fluid out of its contained space into the surrounding area. Examples include embolization to treat GI bleed, traumatic hemorrhage of the pelvis or viscera, chylothorax, hemoptysis, or postpartum bleeding of the uterine arteries. Intravascular stents, both covered and uncovered, may be used as part of an embolization procedure. When stents are used solely as lattice work for the deployment of embolization coils, assign the embolization code. When stents are used as the sole management for an aneurysm, pseudoaneurysm, or extravasation, assign the stent deployment code. Only one embolization code should be reported for each surgical field treated. A surgical field is the area directly involved and immediately surrounding that area. If, during the same encounter, embolization is required in multiple surgical fields, multiple embolization codes may be reported with appropriate modifiers, such as modifier 59 appended. When there are overlapping indications for embolization within a surgical field, the code for the Thanks for watching. Health Information Associates is committed to providing educational products that help coders to be their best. So be sure to check out the other presentations in the CPT Coding Guidelines Review series, as well as our full catalog of courses at hialearn.com. Happy coding!